Welcome to Then There's California, featuring members of the California State Senate Democratic Caucus in conversation about legislative priorities, policy, and other related issues that make California exceptional. I'm Brian Green, and this time around we are in the city of Campbell, California, in Santa Clara County in the 15th Senate District. In his recent inaugural address, California's new governor, Gavin Newsom, affirmed his administration's support for quality, affordable health care for all Californians, and in particular, making a covenant with the people of this state that, to quote the new governor, we will stop stigmatizing mental health and start supporting it. Well, that's encouraging news from the new governor because in reality, up to this point, that support for California's mental health initiatives has seemed more like a mile wide, but an inch deep. For example, several mental health-related access and treatment bills were vetoed by now former Governor Jerry Brown. And some say even state budget counters have not done their due diligence in balancing what is an impactful cost for mental health treatment and services for the 1 in 6 adults and the 1 in 13 California children who have mental health needs, along with their families. So on this edition of Then There's California, we will talk about this gut check moment here in early 2019 regarding mental health caregiving, treatment, programs, services, as we begin a new legislative session with new and returning state lawmakers, a new governor, and what we assume and hope is a renewed interest in being more strategic and accountable in how mental health services are delivered in California. Leading that advocacy and also leading this discussion is a state lawmaker who has spent 3 decades in public service as a city council member, a county supervisor, and a legislator, changing public policy and improving the lives of those who seek and benefit from mental health services in this state. Jim Beall is the state senator representing the 15th District here in Santa Clara County. He is the chair of the State Senate Select Committee on Mental Health and is world-renowned, and I don't think it's overreaching to say that, for his care, his investment, and legislation. We are in Senator Beall's district office here in Santa Clara County with the senator and his 2 guests who bring their own respective significant expertise and agency to the shaping of mental health policy in California. Senator Beall, welcome to Then There's California. Happy New Year.
Yeah, welcome to Campbell, California, my district.
Well, Senator, as we begin here in this new year, looking back at the last 30 years and your advocacy in this, I guess you have seen, if I can use the metaphor, the arc of justice that's finally starting to bend towards some clarity on mental health issues and how we deal with that in California. And right off the start, Gavin Newsom mentions mental health in his first hour in office. Give us some perspective on that.
Well, somebody counted the number of times that Governor Newsom talked about mental health, and I think they came up with 34 times during his inaugural address.
Wow.
I was totally surprised about that, a real commitment to doing something about mental health. He made some real commitments, and I'm real excited about working with him. It's lovely to have our guest. This is Zima Creason, the president and CEO of Mental Health America of California. And Zima is also a new elected member of the San Juan Unified School District Board of Trustees, a school district in the Sacramento area. And we're really happy to have her. She's been a strident advocate nationally for mental health services. And we also are lucky to have Dr. Stephen Adelsheim, Stanford University, child, adolescent, adult psychiatrist, who has directed the Stanford Center for Youth Mental Health and Well-Being in our Stanford Department of Psychiatry. And he's a pioneer in developing mental health policy and systems focused on school mental health programs and working with kids. So we're lucky to have the 2 experts here. I'd like to hear what they have to say about the governor and where we are today.
Sure. Thank you for the introduction. I'm so excited to be here. Wow. That's what I have to say about the governor's first address. Just wow. You know, to have that top leadership really just be explicit about the issue and say the words about, you know, stigma and where we really need to go is so inspiring. A lot of advocates and a lot of people with lived experience and family members have been waiting a long time to have that champion in the Capitol, and I think we really have it now.
It was very exciting. I'm really grateful to hear also the governor really and his support really around early intervention and seeing that as a key priority of the administration as well. In his budget plan, there were some initial funds related to early psychosis related intervention and also looking more broadly at a continuum of prevention, early intervention support. So I think we're all very excited to see what can be developed in moving all of this ahead.
Well, we're already started our legislative process, and we're going to be working with the governor now. We just got his budget, and we're all perusing it, looking it over. And we're also introducing some legislation, and I've introduced some bills on mental health, as I do every year. I think I've introduced probably 15 or 20 bills in my 12-year period so far in the legislature on mental health. Unfortunately, a lot of them have been vetoed. And the first bill I've talked about here is one that got vetoed last year, and we're adjusting it and trying again, and that's SB 10, the Peer Provider Certification Program. Right now in the United States, there's a movement to train and certify statewide people who have experiences working in mental health and working with people with mental health and having mental health issues themselves, to certify them to provide assistance to other people, peer-to-peer. And it could be a young person, a senior, it could be somebody that speaks a certain language or a culture. And we're trying to train these people and certify them so that they can offer assistance to those that have issues. We have a bill that certifies them statewide, creates a statewide certification, and that's SB 10. It requires the Department of Healthcare Services to establish this program and expresses the intent of the legislature that the program will provide increased family support, a fuller continuum of what we call wraparound services. That's a phrase that's used to provide services by looking at individuals and finding out specifically what their needs are, and focus on their recovery and self-sufficiency. So we think that given the fact that right now so few people actually get adequate mental health treatment in California, it's an astounding low number that get adequate treatment. We think that this bill will help provide people with a lot of assistance when they reach a level where they need help. SB 11 is the mental health parity bill, and SB 12 is the Youth Mental Health Drop-In Center. So I'll turn it over to Zima to talk about our SB 11.
Thanks, Senator. Parity, mental health parity. Let's just first start with the definition of parity. It's on par. It's the same as, when we're talking about mental health treatment, mental illness should not be treated differently than physical illness. And we find that in insurance and plan service delivery, that's not the case all the time, in a variety of ways. Sometimes the copays are different. Sometimes there are differences in how many therapy appointments you can receive. We don't cap chemo treatments. Why would we cap therapy appointments? Timeliness issues. Sometimes getting an appointment to see someone for service is much longer than it would take if you had a heart problem. So really it's just coming down to treating the treatment of mental illness the same as any other physical illness. There are laws on the books, both at the federal and state levels already, but we're finding some gaps, and we're really having a hard time with enforcement, making sure that the intent and letter of the law is being followed at all. In my own home, and with me having the positions that I have, we still struggle to find timely mental health services, and we are insured and we are connected, and it's still not what it's supposed to be. And when we're talking about someone that's having a mental health challenge, we cannot expect them to wait. The longer we wait, the closer to crisis we come to. And we really need to get in there early, prevention and early intervention whenever possible. But when someone seeks help or that referral is made, we have a responsibility to get in there and help the person right away. And that's just simply not happening right now.
Just following up on Zima's key point, we can't expect people to wait when they're starting to develop a mental health issue. And the fact is that half of all mental health conditions have their onset by the age of 14, and people are really surprised when they find that out, and 3/4 of the time by the age of 24. And yet we don't have the systems in place to support our young people at those ages when they're really starting to develop problems. And just like any other medical issue, as it relates to parity, people do much better when their mental health issues are treated right away and addressed early. And so for this reason, what's been very important is that we continue to build out models that allow us to create early intervention programs for our young people and their families. So, I worked for many years in school mental health, and we really need to continue to expand and support our school mental health related programs. At the same time, we have many young people ages 12 to 25, which we often call like the second 0 to 3 in terms of an important time around development and growth of the brain and still maturation taking place. For our young people at those ages, they don't have easy access to early mental health support in a way that's comfortable for them. And what we've seen in other countries is efforts to really create those environments. But as yet in the United States, we really don't have what we would call a public mental health system for our young people to come in early and get the kind of care that they need for mental health related issues. So, we have been very interested in looking at how do we build this continuum of early access for mental health support for our young people and families. And so we're looking at these school mental health programs, but then also linking them to what we really call integrated youth mental health sites, which really then provide in the community direct access to early mental health care, drop-in support, primary care, early addiction intervention, supported education, employment, and as the senator was saying as well, an important piece, which is peer support as well. And so we've looked at these other models internationally. We've been partnering with colleagues in Australia and Canada and Ireland who've been developing these models successfully. And we're very excited around the notion of building these programs really starting in Santa Clara County, but hopefully soon in other counties across California. So the senator's bill goes a long way to looking at building support to expand these type of integrated youth mental health services broadly across the state in a way that really is sorely needed for our young people.
Mental health issues are a chronic, ongoing illness that if not treated, just like any other illness, heart disease, diabetes, other illnesses that are chronic, will continue to get worse and worse and worse if you don't treat them. But you can treat them, and you can have a happy life if you have good treatment for mental health. So I think that if you care to look at the emergency psychiatric hospitals in the country and see that what does it cost, doctor, to put somebody for one day, $20,000 a night, to put somebody in an emergency psychiatric facility, something like that. It's extremely expensive. So why wait until the crisis occurs? Why not have these kind of services and support systems to avoid those kinds of disasters for a person? Why wait till somebody has a disaster? We wouldn't do it for diabetes or heart disease or cancer or any other chronic illness.
And we have a phrase for that at Mental Health America. It's before stage 4. When we're talking about heart disease and cancer, we don't wait till stage 4 to act. We get in at stage 1 so that we can do the best we can to ensure the best outcomes possible. Unfortunately, mental illness for so long has been a fail first illness. When you look at the numbers, so few people seek help. It's a small number that even seek help. And then when you seek help, it's even a fewer amount of people that get the treatment that they actually need. And then there's a fewer amount of people that if that treatment, there's a need for course correction or something a little different, something a little new, even fewer go back. So before stage 4, it gives us time to really block crisis before it gets out of control.
For our young people, as much as most mental health issues develop during this period from 12 to 25, it's also the age at which people are least likely to go in for early medical and mental health care because there isn't a sense that the health system is really geared to them. And by developing sites really that directly market to young people and link them to early service creates a comfortable environment to go in for these early mental health issues. And as the senator was saying, we have wonderful evidence now that shows even when people are developing psychotic illnesses and losing touch with reality and maybe even early in the stages of having hallucinations or other confused thinking, that very early treatment really can help people get back on track right away, stay in school, stay in jobs, have a strong social life, and that the more we can shorten that period, which we call the duration of untreated psychosis, the shorter we can keep that time, the better people do 10, 15, 20 years later in terms of outcomes. So early intervention pays really key dividends for positive outcomes down the road.
I think that our mental health advocates are starting to see people like Governor Newsom and other legislators stand up and be counted. We have a mental health caucus in the state Senate, and we generally get 12, 15 people coming to our meetings to talk about their legislation. There's many members in the state assembly that also come and participate. We've had various speakers come in and talk to us. We think that this is the year because Gavin Newsom has now addressed this issue fully in his initial inaugural address, and we think that the legislation and in the budget could be a very successful year for legislation on mental health. So that's why you're going to see a lot of talk and a lot of action on mental health this year.
You're listening to Then There's California. We are in Campbell, California, in the 15th Senate District, talking about improving mental health outcomes in 2019 with the leading legislative voice on mental health issues in Sacramento, Senator Jim Beall of San Jose, along with Zima Creason, the president and CEO of Mental Health America of California, Dr. Stephen Adelsheim, child, adolescent, and adult psychiatrist at Stanford University, the director of the Stanford Center for Youth Mental Health and Well-Being at the Department of Psychiatry at Stanford. And I wanted to ask the three of you here, obviously, discussion of mental health is a very personal issue, as much as it is clinical or statistical. You are all three, I assume, probably parents, but you're family members. What has compelled you as individuals, as the three human beings sitting here with me, to invest your lives in this advocacy? I'll start with the senator.
Well, like almost every single member of the legislature have family members that have mental health problems and issues caused by different things. And I think we all reflect on that. For me, just the system of care had such a lack of empathy. And as Zima said, it just doesn't do anything until you're absolutely at stage 4. That is inhumane. And the other thing is that I'm also on the budget subcommittee on public safety, so I visited 25 prisons. And I visited juvenile corrections facilities in California. And we look at the budget and we look at what's going on in those facilities. A lot of those people are there because of untreated mental health conditions that led them to commit crimes. And I think that untreated mental illness causes a lot of problems. If you want to talk about children, it affects their educational attainment. Zima's just now on the school board, and the doctor works at Stanford. We're going to have to provide special education for a lot of children that have behavioral health problems. The governor, by the way, put $500 million into special education. Hooray, good job, Governor Newsom. So we have to focus on this prevention, intervention. And it's a humane thing to do. It's just that the system has such a lack of empathy, you know. And we have to put that empathy back into the healthcare system for mental health.
Zima Creason, what about you?
Sure. You know, my story, I'll keep it as concise as possible. Really, when I got into mental health 17 years ago was because I needed a job. And once I start learning more about mental health policy and becoming more aware, I realized they were singing the story of my life. I grew up in Southside Sac in the hood. Not a lot of privileges there. I've lost 2 siblings to suicide. One you could tell from their death certificate, but the other was a little different. He really on his death certificate it says he died from complications related to AIDS. However, he made a choice to stop taking his life-saving medication, which is a slow form of suicide. Once I learned more and more, I recognized how many struggles I had but didn't have a name for it. And then if you add in the substance abuse piece, you know, when we turn it into a behavioral health conversation, growing up in the hood, you see a whole lot of that in your neighborhood and within your family. And so once I learned how this topic affected my life so much and learned that my sister probably could still be alive if she had services and supports, I couldn't just walk away. And now it's become my life's passion to ensure that everyone has access to quality mental health services before crisis. And I'm also very committed, and this is one of the many reasons I ran for the school board. You know, if we want better outcomes with adults, we need to do better with our kids. And that means investing in our youth, making sure they understand what mental illness is, what it looks like, what do they do when they need help. But I love the senator's bill for the drop-in centers. There are some that are starting to do that work, but we need more. And I love that we are implementing a space for help seeking, not just identification. Of course, there's a place for that too, but the idea of really creating a space where people can seek help and have that education of, well, what does it look like when you need help is really, I believe, 100% will move the needle where we need to go.
Thank you very much for sharing that, Zima. I appreciate that honesty and sharing that story. And Doctor, what lights the fire in you on this particular issue?
Well, I will tell you that I became interested in mental health actually when I was in high school. And part of it was within the context of my own family, but part of it was that I just got very interested in the brain and how it works, and frankly decided very early in my life that I wanted to be a psychiatrist, and really became committed early on to working with children and adolescents. And I think for me, as I've continued to grow into this field, what's been striking to me is the disparity in terms of access, and really struggling with how this can even exist in our country. We say that 1 in 5 young people may have a mental health issue, but even of that 1 in 5, 70% are unable or don't access mental health care, whether it's a lack of a workforce, has experience with child and adolescents, or the stigma issues or blames that families face around having children or adolescents that are suffering. It's been ridiculous, and it's gone on too long. And I think for me, it's been very important to be an advocate, particularly around child and adolescent support, also because of the early intervention needs. And at this point, I am a father. I have 4 children, and I would say in every generation of my family, we are facing mental health issues, and I think that's the reality in every one of our families in America. And I think it's still very hard for us to talk about, but the reality is mental health conditions are prevalent in all of our homes and all of our families, and I think if we really could talk more openly about that, the advocacy would improve, the stigma would break down, and we would not allow this lack of access to continue.
Senator, based on what the doctor and Zima have both said, and you had even talked earlier about how mental health issues affect the physical ailments that come up, and really in a bigger picture, it seems to me that mental health issues are really the driving factor in virtually all other public policy we're trying to tackle. Homelessness, housing to begin with. I assume you agree with that, right?
Well, if you look at it this way, if a kid has a mental health problem, they're not going to be able to focus and study well. So educational attainment, if we had good mental health for kids, they'd be able to achieve higher degrees of attainment in their education. The foster care system, kids that get taken away from their families because the parents are no longer capable of taking care of them, costs billions of dollars a year. Families that have substance abuse problem, that have children, fetal alcohol syndrome, meth, stroke babies, have developmental disabilities that cost millions and billions of dollars for the state budget. We have the criminal justice system, but just getting to it from an entire standpoint is the healthcare system should work to make our community healthy. And if you exclude certain conditions and people, it's discrimination. I don't really use the phrase stigma anymore. I use the phrase discrimination. It's actually no different than any other form of illegal discrimination not to have good health care in the mental health area. It's a discriminatory aspect of our healthcare system we have to correct.
I really agree. And when you're looking at this with adolescents, you're looking at issues in terms of rates of dropout, you're looking at youth suicide issues, adolescent addiction issues, teen pregnancy issues, and violence issues potentially as well. And if we are doing early intervention work in an effective way, we are helping young people never go down those roads and building those types of early support so that we aren't having to spend dollars in our juvenile justice system in the same way, that we aren't having to put dollars into some of these other systems, because we're building in the early intervention support up front and effectively helping young people and their families not only stay on a healthy path, but then learn ultimately to know how to be actually better parents themselves as they get older and successfully then parent their own children. And so we have a lot of work to do, but there are great benefits in terms of prevention, in terms of linkages to other components and systems if we can do this early support and make it easily accessible.
Ditto everything that was said. I think the only thing I would have to add is too many people are diagnosed in jail. They don't even get a diagnosis until they go to jail. You have to fail first to get the help, and that's absolutely unacceptable. I also want to make a note about violence. someone living with a mental illness is more likely to be a victim of violence than to ever commit a violent act. So to the safety of people that are challenged, we have a social responsibility to protect our community and not discriminate people in need.
We could go into a transformative year or 2 years on mental health and a lot of these issues. One of the examples is people are starting to recognize that educational attainment and violence are not a good mix. It's a toxic mix. So a lot of the children that live in environments where there's a lot of violence, they just can't get a good education. And we have to help these communities and these kids achieve the maximum they can. So I think these programs are all interrelated. A lot of time government kind of looks at their own program, their own department. It sort of silos the issues. This issue is not a siloed issue. This is a cross-systems issue. And one of the things I like about Governor Newsom this year is he's proposing a mental health czar. And maybe these two people can apply for that job. I mean, we have to have some strident advocate next to the governor, helping him achieve what he wants to achieve. So that we're going to have a mental health czar in the governor's budget proposal this year.
So I guess we have two candidates for mental health czar. But really, truly, it is a nonpartisan issue. This isn't Republican or Democrat. It affects every family. It affects everybody across the board.
100%.
So maybe some comment on that from our guests.
Well, a couple things. We're also dealing, certainly in this local community, with issues actually related to youth suicide as well, and are facing issues around even how the media portrays mental health issues, which has been a really sort of active issue as well that we hope to be able to address in terms of being able to bring young people to the table to help create these resources and supports. And I think, as we go forward, being able to bring all of the community together around these mental health resources is going to be very, very important. And I think we have some wonderful opportunities now and to really be able to build some early support, and it's a very exciting time.
I agree 100%. It's an exciting time. We have so much opportunity with this governor, with the senator, just paving the way and really pushing through to make sure that this conversation isn't a hush-hush thing anymore, that folks are talking about it, that we're really busting that stigma and ending discrimination against mental illness. It's really has been inspiring. There's a couple of other legislators that really have followed suit and are really starting to step up and not be scared. Things that we're scared of, we tend to hush about, right? The more we talk about it, the more we can say, hey, this has happened to me too, and really build that system of support. That's what it's going to really take to create psychologically healthy and safe space for people to get the help and seek the help that they really need and be honest about it. And if it's ever going to happen, now's the time with the leadership that we have in place. And, Mental Health America of California, we're a grassroots advocacy organization. We come with the stakeholder voice. We seek to elevate community-defined practices and community-defined needs so that folks can seek help and feel safe doing so. And we are so thankful for the senator for really getting that, really getting the community, really getting the people with the shared goals of making sure people in need have the help that they seek.
And one thing I want to reference back to in terms of really this being an issue that everyone on every side of every aisle can step up in front of. One of the things that's mentioned in the language around SB 12 and these centers is that internationally, when you look at other countries like Australia or look at Canada, Ireland, other places, as much as there have been points of contention within their legislatures, this is one issue that everybody is agreed on in every one of these countries. And so across the aisle, what you find when these sites open up is not fighting over, we don't want to put the dollars in here. It's how do I get one of these centers in my community? And you find every legislator pushing based on the parents and youth interest in wanting one of these in their town and wondering how we can make these happen. And so with that comes increased resource and everyone's political will going to support our young people and families.
Just to piggyback off of that, it costs a lot more to not treat mental illness than to set up a system to support people that need help.
Wrapping it up, I have to say for my colleagues and elected officials, there's been a lot of surveys done on various issues. I just have to say this. If they survey the mental health issue and whether or not their voters want them to do something about mental health, guess what happens? It's like Republicans, Democrats, independent voters resoundingly almost at the same level all across the board support more treatment and better programs for mental health and substance abuse. You do not have very much opposition to this. So if you want to get reelected, my fellow colleagues, you better start campaigning on mental health issues, because if you don't campaign on mental health issues, a lot of people out there in this grassroots movement will notice that. So please stand up for good mental health programs.
Thank you all for your great inspiration and helping the rest of us rise to the occasion on this issue of mental health, and helping puncture the mindset that creates these cycles of misdiagnosed, mistreated, stigmatized, the discrimination, as the senator said, all the challenges that are related to mental illness in California. Thank you so much. Azima Creason, the president and CEO of Mental Health of America of California, who came all the way down from Sacramento to be with us, and Dr. Stephen Adelsheim from Stanford University. And Senator Beall, your work that continues on behalf of not only these folks here, but the rest of California.
Thank you. And we have a peer support group in our family. My wife Pat and I are very involved in. And I just at the end want to urge any family that has a mental health issue to reach out. You'll find other families that will help you. Reach out. We will be there to help you. Thank you.
Thank you. Then There's California is a production of the California State Senate Democratic Caucus, with technical and production assistance from Martin Ashley, Brian Shadden, and Rainier Sabiniano. And our podcast logo design, everybody loves that, is from Tim Davis with the Dem Caucus. From Campbell, California, in the 15th Senate District, I'm Brian Green.
And I'm State Senator Jim Beall. Thanks for joining us on Then There's California.